It is a well-known fact that 10 years following an anterior cruciate ligament reconstruction, it's not uncommon for patients to present with kneecap pain and degenerative changes behind the kneecap or the patella. This is often shown radiologically in X-rays and MRIs. So the question must come to our minds, what are some of the causes for this early degeneration behind the kneecap following ACL surgery? And I've come up with 2 or 3 theories. Theory 1 is that through the rehabilitation, the early rehabilitation with physiotherapists, it's very common for a lot of physios to do squats, lunges, and so forth early in the rehabilitation process. And we definitively know from biomechanical studies that we look at the force behind the kneecap when we go into deep squats or squat positions, and it's enormous. We know that if you go into a deep squat position for a 70 kilogram male, there's 20 times body weight on the kneecap. Into a half squat position, it's 7 times body weight. So the deep squats that we're doing to try and build up quad strength as part of our rehab can often damage the patellofemoral joint. And it goes without saying that a very large percentage of ACL rehabilitation programs will have squats and lunges. And we would pivot and say, why not get our patients to do very high load, small range exercises, like a leg press from 0 to 30 degrees on a high load, small range. Knee extension using a kettlebell, an open chain exercise at 0 to 45 degrees. Single leg Smith machine, 0 to 45 degrees. Small range, high load. It will increase the quad strength, but not sacrifice the patellofemoral joint. And could this be the thing that's producing these changes later on 10 years down the track that we see in patients following ACL surgery? The second thing, we know with patellofemoral pain and degeneration around the patellofemoral joint, the quad strength is so crucial in getting good tracking of the kneecap. Thus, the next thing is, do we adequately strengthen the quadricep post ACL surgery? And time again, when I review patients, even in the early parts of their rehab, there's different factors that could be impacting, but a lack of quad control is the other point. So we need to be looking at high levels of quad strengthening exercise. And on that point, how often when you go to your physiotherapist in your rehabilitation, do they test the strength using a handheld dynamometer or some sort of apparatus to get strength studies? Because this is so important. If they're not doing it, you need to find somebody who will do it, because we know the strength has a huge impact on this. And then the final thing is, in producing these degenerative changes at the 10-year mark, are patients going back and doing activity too quickly. It's interesting, in my clinic here, we don't get our patients back onto pre-jumping and the high load programs like that until 5 months. And I'm holding them back. I'm quite slow. We're holding them back because we want them to get superior quad control so that they get good tracking of their patella. And before we start putting them onto a pre-jumping program and then an interval running program. And so these are some of the factors that I believe could well impact on these increased levels of patellofemoral degenerative changes at 10 years that are very much to do with how you do the rehabilitation. Small range, 0 to 45, high load, looking for amazing quad control and making sure we do testing of that before we put them into their loading programs, in my mind, will reduce the amount of degenerative changes that are astonishingly high at the 10-year mark. And we hope that our patients will think about those things, and also the physiotherapists and the surgeons will think about reducing the amount of degeneration through their rehabilitation, that could well be adding to these degenerative changes at the 10-year mark. Thanks and happy exercising.